what we're going to do today is to discuss OET writing. Okay.
Yeah.
Now, you know that OET writing is a letter. Okay.
Yeah.
And basically, you have 5 minutes to read only the task, and you have 40 minutes to write.
Yeah.
Okay. So in the first 5 minutes, you're not allowed to write anything. Okay.
Yeah.
Now, I want to change this 5 minutes to read and 5 minutes to read and mark the essential information and organize.
Yeah.
And 30 minutes to write and 5 minutes to proofread. Okay.
Yeah.
So basically, that is what we should be doing for a better result. Okay. Now we also have some considerations here. One of them is, the practicalities. The letters are usually referral letters, so that is the most common type, okay?
Yeah.
But sometimes we have discharge letters.
Yeah.
Sometimes we might have transfer letters, okay?
Yeah.
Now, so in order to score high in a test, what should we do?
Yeah.
Could you tell me?
I think that to refer to which kind of specialty or refer to which community, and choose the best information related to this specialty or maybe community.
Okay. So this is about OET. Now, if I ask you about any test, for example, suppose you want to do a PLAB exam, what do you do?
Study hard, concentration.
What do you study?
Is the right material, and is a big question for me about this test especially.
What is the right material?
I think that the formal material, because the other editor, the other writer maybe provided non-formal questionnaire or etc., and is very different with the formal test or formal kinds of questions, and it is important because it maybe lead us to the wrong way.
Okay. So how do we find out what is what is an appropriate or formal? I mean, except for formal, let's say, how would you know that what you need to read and what you need to cover?
Especially about only about the OET exam.
In any exam.
Any exams. I think that maybe the formal website of this any kinds of exam refer you to very regular and formal references.
Okay. Okay. Right. So first of all, we need to know what skills are tested. Okay.
Yeah.
Do you agree?
Yes, exactly.
So that's the first thing we do. We need to find out what skills are tested. And then after that, what do we need to improve those skills?
Yeah.
Do you agree?
Yes, exactly.
Okay. So, what do you think? What skills are tested in OET?
For skills, writing, reading, listening, and speaking.
Okay, writing, reading, listening, and speaking. Okay.
Yes.
So, and how do we improve those is what we're going to do. Okay. Now, I'm going to ask you, what skills in writing are tested? Because writing is a very general world.
Yes.
So what is tested in writing?
I think that is based on the OET center is divided in 5 or 6 groups, and scoring at this and need to overcome on this category. And honestly, I don't know about more
Okay.
criteria.
Okay. Oh, criteria. What criteria?
I think that is about grammar, coherence, cohesion, or maybe choose the appropriate information, and I don't know more.
Okay. So, what are the marking criteria? That is our question, yes?
Yes.
So, okay. So we need to know for any test, okay? It's not only for OET. For OET, for PLAB, for IELTS, for any test, what we need to know is what skills are tested.
Yeah.
And how do we know that? Because we need to know, and so how do we know that? With checking the marking criteria. We need to find out how we are marked. Okay?
Yeah.
So how do we know that?
I think that is better to know more about the formal marking criteria the OET center announced to us.
Good. Okay. Let's see. Okay. Fortunately, I have the slides here. And so we have some new criteria, which is the updated criteria.
Yeah.
And this is new since August 2019. So it's not long ago. It's really just around 6 months ago.
Yeah.
Okay.
Yeah.
And the previous criteria was this. And it was overall task fulfillment, appropriateness of language, comprehension of stimulus, linguistic features, presentation features. And this was long gone. Then the updated criteria is this: purpose, content, conciseness and clarity, genre and style, organization and layout, and language. Okay?
Yeah.
And you see it has changed so much.
Really?
Okay. So let me tell you something. There are a lot of sample letters around which are all based on the previous criteria. Okay?
Yeah.
So if you write based on the same pattern or based on the same criteria, you don't get enough marks because the criteria has changed. Okay?
Yes.
So the conclusion is that we do not use the existing sample letters, which are, I don't know, there's a 400-page E2 language or on any other references. So basically, we do not use them. Right. So we don't have anything to do with the previous criteria anymore. What we deal with is the new criteria. Okay.
Yes.
And what I would like you to do is to make sure you know this by heart. Okay. I mean, later on, we need to check each of these and make sure, put a check mark here and say, okay, you've done this, you've done that, you've done that, okay?
Yeah.
Um, the first one, which is purpose, has 3 marks, okay? It's 0, 1, 2, 3. So there's 4 possibilities, okay?
Yes.
And the rest have 7 marks. So there are 8 possibilities from 0 to 7 for each of these.
Yeah.
When you are scored, you're scored based on these, okay? They look at the content, they say, okay, all the content is here, that's fine, 7, okay?
Yeah.
They look at the purpose, they say the purpose is okay, 3. So then they add up all of them and then they convert it to 500. Right. So this is some comparison between the new and the previous. Okay.
Yeah.
Okay, we start from the purpose. So basically, why are we doing this? Why are we looking at the marking criteria?
I think that is better to know that why what we write and for what we focus on information or etc. to get great high grade score.
Yes. What do we need to improve those skills? Okay. So that's what we want to find out. We want to find out how we can get a better mark. Okay. So we need to write a good purpose. Okay. And these are the this is a description of a good purpose. Let's see. So does the letter give a quick and precise sense of what is being asked of the reader? So look at that, quick and precise. Okay.
Yeah.
So we don't want something which is not quick. We don't want something which is not precise. Purpose for writing needs to be introduced early in the document. Okay. Early.
Yeah.
Expanded on later. Expanded later. Immediately identifiable. Immediately identifiable. Example. I'm writing to refer patient X, who is now being discharged from hospital, into your care. Okay.
Yeah.
So, and then specific instructions on continuing care should be listed later in the letter. So later you actually explain more about the discharge and what needs to be done in discharge. But here it is quick and precise. Very quickly, I'm referring this patient who is being discharged. Okay. So,
sorry, it's not important to say that the which date he or she discharged. For example, now being discharged today.
something which is obvious, we don't need to say.
Yes.
Okay, any problem here?
No, no, thank you.
Okay, so the first criterion here is purpose. And it needs to be said early in the document. And it needs to be early in the document. What was the other?
Expand. Early and precise.
Quick and precise.
Yeah.
So, what else?
Introduced early.
Okay.
Expand on later.
Okay.
And immediate.
Expanded on later. Okay. So, any problem here?
It's immediately identifiable. It's don't make sense for me.
Immediately identifiable. It means you can identify that. The first thing you look at the letter, immediately you can you know this is the purpose.
Oh yeah. Yes.
Okay.
Okay. Thank you. Yes. Okay.
Right. Let's go to the next part.
Yeah.
Does the letter, this is content.
Yes.
The content is, does the letter have the necessary information and is it expressed accurately? So basically it says all key information is included. All key information is accurately represented. Okay.
Yeah.
So we have two questions.
Yes.
Key information, so that is, we are going to number 2 now, which is content. So basically necessary, key information included. So the key information is included and the key information is accurately represented. Key information accurately represented. Okay. So what is the key information?
I think that anything is related to the this diagnosis or the main chief complaint of the patients.
Okay. I look at here. Audience awareness is important. What does that mean?
I think that the audience need to know what we did and what we expected from him or her.
Who needs to be aware of the audience?
Sorry, I don't know.
Well, this is telling us what a candidate needs to do. Okay.
Yeah.
The candidate needs to include the key information. The candidate needs to represent all key information accurately. The candidate needs to have audience awareness. So you need to know about the audience.
Yeah.
And why is it important? It explains. It says because key information will vary in different tests. Yeah. Okay, I'll give you an example. You have a task, which is to write a letter to a nurse.
Yeah.
And with the same case note, they say also refer this patient to a physiotherapist. Yeah. Do you think the letters would be the same? Can you send the same letter to both?
No, didn't work for the same because the information for each of them is different.
Good. The information is different, the purpose is different, everything is different, okay?
Really.
Let's see. Audience awareness. It means we should know who we are writing to. Okay? And that is important because key information is different. We need to answer this question. Basically, what does the reader need to know to provide continued care for this case? So the reader can change. Okay?
Yes.
So what the reader need to know to provide continued care for this case. Okay. So basically, because the reader changes, the information changes. All right?
Yes.
Okay. So now we know what is key information. The information that the reader needs to know to provide continued care for this case.
Yes, yes.
Okay. So when we choose the content, basically when you go through a case note, you need to decide what is key information. Now I tell you something. I usually, this is something I thought would help. Basically, I say we have essential information, which is the key information. We have some good to know information, and we have some unnecessary information.
Yes, exactly.
Okay. Basically, the key information is these two, good to know and essential. These are the key information. The rest is unnecessary. Okay?
Yeah. Yes.
Good. So do we have any problem with content?
No.
No.
No, thank you.
So the next is conciseness and clarity. That is the let's see what it is. Okay.
Yeah.
Conciseness and clarity. Okay. Right. Does the letter omit irrelevant information and summarize the relevant information efficiently and effectively? Okay. So it's got two parts. Omit irrelevant information means to omit this. Omit irrelevant information. And summarize the relevant information efficiently and effectively. Summarize the relevant information efficiently and effectively. What is the difference between efficiently and effectively?
Wow. I don't know.
Mm-hmm.
I don't know, honestly.
Okay, efficiently means comes with efficiency. It means with giving the best amount of information with the lowest number of words.
Yeah.
Okay. So basically, efficiency means doing the best with losing the least. Like cost effectiveness. Okay.
Yeah.
That is efficiency. So, for example, we say energy efficiency. We need to know how much energy we lose. We don't want to lose anything. Now, effectively means what you do is effective. It's making an effect, basically. It is what the purpose is. It is doing the job properly. Okay.
Yeah.
So with efficiency, we talk about a better result. With effectively, we look at the better effect.
Yeah.
Okay?
Yeah.
Good. So when we summarize the relevant information, it needs to be in the least number of words possible, and it needs to be in the best way expressing what we want to do.
Yeah.
So these are the negative marks. If there is unnecessary information, now if you have unnecessary information, you will lose marks anyway. But you will lose marks if it is very distracting. It means that your key information is lost.
Yeah.
Or the clarity is impacted. Okay?
Yeah.
So the question is, how well is the information summarized and how clearly it is? Basically, efficiently, how well, effectively, how clearly.
Yeah.
Okay?
Yeah.
So if irrelevant information included, how distracting is it? Okay. So basically, we need a clear purpose early in the document. We need to find what the relevant content is for that appropriate audience that we are sending the letter. We need to omit the unnecessary information, and then concise means very small and but effective, okay, but efficient. So how well have we summarized? So we need to summarize, okay?
Yeah.
Good. Any problem here?
No, thank you so much.
Good. Okay. The next one is genre and style. What is that, genre and style?
Oh, I don't know.
Have you heard the movie genres or music genres?
Yes. About the movie and the music, I know that. But about the letters, I don't know.
Okay. So it explains here. Does the letter have appropriate register and tone for its purpose and audience? Okay.
Yeah.
What is that? Let's see. So number 4 is genre and style. Okay. And this means that appropriate register and tone.
Yeah.
Okay.
Yeah.
The register of a language is where this language is spoken and how basically is it spoken in a court or in a surgery, in a hospital, on the street, or in a bar. Okay, so that's the language which is spoken is different.
Yes, exactly.
So you cannot talk slang in a formal setting.
Yeah.
How do you speak in or how do you write in clinical situations?
I think that is formal.
Yep.
Stuff.
It's rather formal. Okay.
Yeah.
So it's actually we use a clinical and factual language and non-judgmental. Okay.
Hmm.
So we cannot say someone is fat. Okay.
Yeah.
Okay, we go here. Clinical and factual. So that is the register. And professional register and tone. Okay, what is professional register and tone?
I think that we need write as a doctor
Yeah.
to others health professional.
Okay, and it needs to be somehow respectful. Okay.
Yes. Okay.
We don't write. We're not writing a complaint letter. We're not writing a sarcastic letter. Okay.
Yes.
So basically, what we're writing is a respectful letter, and it is appropriate to that audience, to the person we're writing. Now the question is abbreviations and medical jargon. Could we use them?
No, no, no. Never, never, never use it.
I don't agree. It says here abbreviations and medical jargon used appropriately.
Yeah.
This means that a reader from the same medical discipline, you can write medical jargon and abbreviations. But for a reader from a different medical discipline, you need to think, you need to see whether they would understand it. And for a non-medical reader, yes, you don't write it. You don't write any abbreviations or medical jargon.
Oh,
But remember, most of the time you're writing a letter to refer, discharge, or transfer a patient.
yeah.
But in any case, so abbreviations and medical jargon used appropriately.
Oh, yeah. It's great.
So basically, I don't agree if someone says write everything like blood pressure or now suppose you're writing to a gynecologist.
Yeah.
Do you think a gynecologist knows what LMP is?
I think that surely no.
Okay. Can you tell a gynecologist G5P2AB2?
No.
What does that mean?
As a GP, I don't know.
Oh, come on. Gravida 5, para 2, parity 2, abortion 2.
Oh, yes, 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 I know that. No, I remember that. Yes, I know that. Yes, 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 exactly.
Okay. So a gynecologist knows what BP is, what PR is. Yeah?
Yes, exactly.
Okay. So how about DM?
I think that, yes, knows that.
Okay. And HTN?
Yes.
IHT?
Yes, as the same.
MI?
Yes.
Okay. So if you're writing to a doctor, you can use these for doctors. Okay. Now, if you're writing to a nurse, you need to think. Now, if you're writing to a midwife knows this.
Yes.
Yeah, that's fine. If you're writing to a nurse, they would probably know about these.
Yeah.
Okay. So depending on who you're writing to, you can use abbreviations and medical jargon. Okay. Any
Yes.
problem?
No, 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 thank you. And do you have a list of appropriate jargon or medical abbreviation and share with me?
I don't have a list, but there are lists. You can search but yeah, I don't have any really.
Thank you.
I can have a look. Okay, and the next one is organization and layout. Okay,
Yeah.
let's see what this is. And layout. Right. So, appropriate paragraphing.
Yeah.
What does that mean?
I think that is classify. For example, one paragraph for the social or past history, one paragraph about the today's visit, one paragraph about the conclusion.
Okay. We will talk about this later. Logical organization.
I think that is the chronological time, maybe.
Okay. It needs to have a logic.
Yeah.
Okay. Key information clearly highlighted. What does that mean?
I have no idea.
Okay. So you remember we talked about key information, okay?
Yes, exactly.
So we know what key information is. Key information is essential and good to know information.
Yes.
So what we don't know here is how we highlight them, yes?
Yes, exactly.
Can we highlight them with a highlighter?
No. I'm sure that maybe with a kind of writing or
Okay.
a kind of words, or I don't know.
How do we highlight?
Maybe please note it is mentioned that,
Good. Okay.
uh, or I have no idea more than this.
Okay, so we can use some something that we call we can use discourse markers, as you said, like please note, or we can say it is important. Okay, so we can use some discourse markers, but we can use other ways as well. Um, like earlier in a paragraph, okay? Because at beginning of the paragraph is usually most noted, yeah?
Yeah.
It's like a main idea you're giving at the beginning of a paragraph and the rest is supporting information.
Yes. Exactly.
So if you want to highlight something, you put it at the beginning of a paragraph and you actually mention that it is something which is important. But please note doesn't work for every audience, okay? You can say please note this to someone, for example, you're writing to a nurse or you're writing to a colleague. But if you're writing a referral letter, you don't say to a consultant, please note. It is too strong. You need to be a little bit. You can say, may I draw your attention, or may I emphasize, or something like that. Okay.
Yeah.
So, um, an appropriate layout. What is that? Appropriate layout?
Appropriate. I think that how to write the address or maybe how to
Exactly.
anything.
Exactly.
Yeah.
Exactly. So basically, it needs to have the format of a letter, and that is how we write it. Okay, good. Any problem here?
No, thank you.
And so we go to the next criterion, which is language. So what about language?
Languages, English, and
Does the letter have suitable and accurate vocabulary, grammar, spelling, and punctuation?
yeah,
Okay, suitable and accurate.
yes.
Suitable and accurate. What? Grammar, vocabulary,
Punctuation.
spelling, and punctuation.
And maybe the article.
Uh,
Oh, it's included in grammar.
yes. So the language used needs to be accurate, used appropriately, not interfered with reading comprehension or speed. Okay, comprehension or speed. So these are important. Okay, so accurate. What else was there? Appropriate.
Yes.
And not interfering with reading comprehension or speed. Okay. What does that mean? It means that the reader needs to read easily and quickly.
Oh, yeah.
Appropriacy is more important than the range of linguistic features. Okay, what does that mean?
Range of linguistic features, maybe different tenses or different linkers.
Good. So, appropriacy more important than range. Okay.
Yeah.
I mean, in some examinations, we might tell you you need to write, you need to use a lot of different vocabulary items, or you need to use a range of grammatical structures, but not here. Here, the appropriate language is more important. Okay. In some examinations, we say write in addition, besides, however, and that sort of thing. It is not here. It is not the case. We want something that can be read very quickly and with speed.
Yeah. We cannot use. We cannot use however, although, or in addition to. Yes.
Yes and no. So it's actually we need to look at those later.
Yeah.
Yeah, we will. Okay. Okay. So now that you look at here, we have 1, 2, 3, 4, 5, 6 criteria. Okay.
Yes.
And how many of these criteria is language?
1 out of 6.
Okay. So what do we need to do to score high in this exam?
I think that is better concentrated more other criteria except of language.
Okay. So basically, they say, these are the slides for the teachers. Okay, this is for teachers training. This is what we had for when we were training to teach OET. So what it says is there is a strong focus on creating a letter which is relevant to the reader within that particular context. Okay?
Yes.
So, relevant to the reader in that context. Reader, context. Okay?
Yeah.
There is lower focus on grammar than other writing tests, obviously. There's not much focus on grammar. You need to be flexible rather than plan one exact way to write every OET letter. Flexible, and that's what we want. Using templates for writing is strongly discouraged. Okay, so strongly discouraged is just one weaker than is forbidden. So it's nearly forbidden. Is strongly discouraged. It means don't do this. Okay.
Yes.
If you do templates, you will lose marks.
Yeah.
Okay.
Yes. Yes.
So the tasks are the same. They're not changing. The difficulty of the task is the same. Only the marking criteria changes. Ensure the purpose of the letter clear is in writing tasks. And that is because if you get the purpose wrong, the whole letter is wrong. Okay?
Yes.
And it says you need to, it's for teachers, it says update in-house sample answers. It means change the sample answers because they're no longer relevant. All official OET content will be updated soon, okay? And update curriculum content. So, basically the changes are writing sample answers have a big change. Minor changes, test strategy documents, purpose immediately apparent. So you need to emphasize this, and less importance of grammatical range. So it's no longer necessary. What doesn't change is the practice tests and the skills.
Yeah.
All right?
Yes.
Okay. So, is that helpful?
Yes. Surely.
Okay. So, with knowing this, now let's see how we can actually approach the writing test, okay?
Yes.
So, we go to the approach. Right. So when we are given a case note, you are supposed to read it for 5 minutes, okay?
Yeah.
So read the task. So when we are reading the task, what should we read? Which parts?
The first I read that the end of letter to which we refer or transfer how is the letter referral, discharge, or etc. And if the refer to who we try to refer the patient.
Yes, very good. We read the end first. Why? To find out who is writing to whom and why. Okay?
Yes.
Good. Then what do you read next?
I usually read start reading the case note from the first.
Okay. I suggest you read the last consultation or the last entry.
Oh,
because that is the trigger for the letter.
Mm-hmm.
Okay?
Yes.
Do you accept?
Yes.
Agree that?
Yes.
Okay. And then you read the rest. Okay.
Yeah.
Good. So that is 5 minutes. And in these 5 minutes, when you're reading the rest, what you're looking for?
From the first consultation and after that the sequential follow-up visit, no?
You look for key information, okay?
Yeah.
Okay. What are the key information?
It's completely related to who is whom is going to read this letter.
Okay, so basically that is essential and good to know.
Yeah.
Good?
Yes.
Yeah. Okay. So so that is 5 minutes, and 5 minutes have passed, and then you can now start to read the task and mark. What should we mark?
I think that is better to highlight it, the appropriate information, and focusing on to write this.
Okay, essential and good to know.
Yeah.
Okay. Now, sometimes I suggest what you can do, which could be helpful, is to decide where this the matter starts. Okay. Suppose you have, you know, in our GP surgery, I had a patient note, and this patient note might have something like 50 entries, okay?
Yeah.
But when I want to write a referral letter, do I need to read all these 50 entries?
I think that no, it's the need to select the information for whom and completely related to for why we decided to refer and for whom we are writing.
Okay, so basically we go back to the beginning of this matter, okay? So basically if you have 6 entries and 3 of them is because of headache or a stomach pain or diarrhea, and then you want to refer this patient for headache, then you need to start from headache, okay? You don't actually go back to other problems which are not relevant.
Yeah.
Those might go to the good to know, or to they might be relevant or maybe not. Okay?
Yeah.
Good. So you go back to the beginning and decide what in what order. Decide on the logical organization. Okay? What is a logical organization? We usually say you can use SOAP. Okay? Do you remember that? Subjective Objective Assessment Plan?
Oh, yes. Many years ago.
When you're writing a sort of what do we call it? Progress note. When you're writing a progress note, you first say, okay, how the patient is feeling, what they're saying, then your examination and what you can find objectively, then what you think the assessment is. Is the patient stable, not stable, is better, is worse?
Yeah.
And your plan, for example, discharge or transfer or change medications, whatever. Okay?
Yes, yes.
Right. If you're going to, again, about logical organization, if you're going to talk about a patient's test results, do you say which one do you say first? For example, you have blood tests, urine tests, X-rays, ultrasounds.
I think that maybe the lab finding is the first, and after that, saying about the X-ray.
That's right. And then X-ray, and then ultrasound, then CT scan. So it is the same way that everything has been introduced, okay? Or the same way that you perform.
Yeah.
Okay.
You need that. You say that when we start to writing this, the order of, for example, a patient has one X-ray, one sono, and one CT. And in order to write up this, need to adopt it with the case note. If the case note, the first mention about X-ray, we need to write the first X-ray in my letter.
Mm-hmm.
Is it? Okay.
We need a logical organization. Okay, do you remember this in organizational layout? We need a logical organization. So even if in case notes it is not logical, you need to change the place. Okay. Yeah. Or if the patient has had 2 X-rays, you just say, okay, the patient had 2 X-rays. The first one was normal. The second one was this.
Yeah.
Okay.
Yes, I know. Yes, thank you.
So after you read the task and mark the essential and good to know information, and you decide on your organization, you start to write. Okay.
Yeah.
Okay. So write. Okay. You write the letter. Where do you start?
From the top of and start with address.
Okay. Receiver.
Receiver, yeah.
Then date.
Address, date.
Salutation, dear whoever it is.
Yeah.
And then
patient.
Reference patient's name and date of birth. Why date of birth is important?
I think that is for identify the patient.
That's right. It's a denominator. It's basically like the father's name when we used in Iran. Okay.
Yeah.
So and then the next one is the purpose. Okay. So early in the document, the first paragraph in the letter is purpose. Okay.
Yeah.
And then you write about, you summarize essential information efficiently and effectively.
Yeah.
And then you can also write the good to know information in next paragraph. Then in the next paragraph you write what you expect or the plan. Plus any relevant connection or side matters. What does that mean?
I have no idea.
Okay. Sometimes you're talking to your partner and the kids are around and you don't want the kids to hear. Okay. So you just say, okay, the kids. And what does that mean?
For any disturbance or anything.
So it means be careful, the kids are around, okay? Or you're talking to a consultant and you say, okay, you see, this patient keeps coming to my surgery. Okay, I've seen this patient 4 times in the last month, in the last 5 weeks. What does that mean?
It means that this patient is mine and continuously followed by myself, by me. And if you have need to know more information, can contact to me and I help you, or maybe after the treatment you can refer the patient to me.
Also, it means that you're saying to the consultant that this patient is very anxious, and this patient, whatever I say, whatever I do, the patient is not convinced. Okay?
Yeah.
Or if I say, for example, this patient's sister had the same problem, and she was seen by yourself, and she had a breast lumpectomy plus reconstructive surgery. Therefore, she would like to be referred to you. So, what are you saying?
I think that we transfer the patient's desires.
Okay. And these are the side matters, what they're relevant. So it's a relevant connection. The surgeon might ask, why are you sending this patient to me?
Yeah.
Why aren't you sending this patient to another surgeon? Okay.
Yeah.
So you actually add this to your letter, and these are the side matters that are significant, basically. Okay.
Yeah.
Good. Are you tired?
No, no.
Good. Shall we do a letter together?
Yeah.
Let's have a look at that.
Oh, this is my letter.
Okay, it's a Mr. Elvin. Let's see. Okay, how many words do you have here? 277. Good. Quite a lot. Okay.
This kind of case note is very problematic for me because the patient has several consultation meeting, and all of this is relevant to the condition, to his or her condition, and I cannot choose or select 2 or 3 out of whole of them, and for this reason it's difficult for me to write in this.
Okay. So this patient is yeah, obviously most of the tasks are the same. Okay. There are several different criteria entries, and you have to summarize that. So how many words are we asked to write?
I think that is better a range from 180 to 200.
Okay, so that's the guidance. Now, let me tell you something. It is just a guidance, okay? So if you write more or less, it doesn't matter. What is counted, this is clearly what the answer I received from OET. It said, does the word count matter? And they said, words are not important. But the information is checked. Okay, so the content that is necessary is counted, basically. But also, I was told that if you have a standard case note, which is prepared by OET, the best letter that you write with all the content and efficiently and effectively summarized, and basically a perfect letter would be between 180 to 200 words.
Yeah.
Okay?
Yes.
Right.